Heart attack symptoms. I mean, traditionally and commonly, classically, patients will complain of chest discomfort, heaviness. So when they point their fingers, I got a chest pain here, doctor, it's most likely not going to be a heart attack because it's one finger and they have 1 or 2 seconds. So commonly, if they say, when I walk up the staircase, I have this discomfort or heaviness, I can't breathe, maybe they've got a heart problem. What do you think?
Yeah, you no idea how many times I've heard that.
Yes.
They will say to me, it's not a pain, doctor, it's not a pain, macam discomfort, macam.
Yes.
And then some of them, a lot of them say it feels a lot like gas, like macam gastric, some sort, burning, some sort like that. Bukan sakit, although we call it chest pain, right? But so, there's such a variation of possible presentation for this.
Yeah.
The most common is chest pain. They can get breathlessness, susah nafas, right? Some people, especially like elderly people, people with diabetes, some just complain of feeling tired. Do they actually get symptoms? So I think the best description I've had of the chest pain somebody gave to me is that it feels like an elephant sitting on my chest. Not that I've ever had an elephant sitting on my chest, but that's probably what it feels like, this severe heaviness. Our best advice is, if you're not sure, get it checked. Is it preventable? Most of the time, yes. I think, most of the time, yes. Okay, this one we just clarify about risk factors. When you talk about preventing, you're talking about modifying risk factors, yeah? So, there are 3 risk factors you cannot modify. You cannot modify, number 1 is your family history. If you have a family history, your father had a heart attack, then you're automatically high risk. Okay. The second one you cannot modify is your age. As you grow older, your risk increases. Nothing you can do about that. And the third one is gender. Males compared to females, same age, everything else being equal, we have a higher risk.
You can modify your gender.
You can modify your gender, but it doesn't change the risk. It doesn't change the risk. Yeah, but the risk doesn't change. The rest are the ones which can be modified. Lack of exercise, obesity, high blood pressure, high sugar levels, high cholesterol levels, smoking. So all those which can be modified. So those are the things we need to concentrate on to prevent heart disease.
So the answer here is totally.
Totally preventable.
Yes.
Not totally lah.
Some heart disease that you're born with, like hole in the heart, that one is not preventable.
Yeah, maybe.
But the kind of heart disease like heart attacks, like that's totally preventable.
Yeah. No, why I said totally is I think the message out there is just to say that it's preventable.
Yeah.
I mean, if we say that some can, some can't, then you're like,
Yeah.
So I think, what you want to say is that it is preventable. Well, majority lah.
Yeah.
Well, I think cure is a big word. So I think there are, not many things that you can cure, but I think most things that we can treat. So I think the key here is prevention. So I think if you can prevent, that is the best. And if you have some form of heart disease, and majority, we can treat it to an extent. So if you have a hole in the heart, we can treat it. You got palpitations, we can treat it. And if you even have blockages, most of the time we can treat it by stenting or by bypass and medication. So I think majority you can treat heart disease, but I think the key is prevention. So if you can prevent heart disease in the first place, it's way much better.
When we talk about coronary artery disease, the one which causes blockages, heart attacks, right, it's a progressive disease, so it tends to get worse as time goes on. So no matter what you do, right, there is a tendency for it to get worse, unless you have a real change in lifestyle, etc. So are we able to cure that? No, we can't cure it. The long and short answer is no, we cannot cure it. We can treat it, we can control it.
Can slow it down.
Can slow it down. But we cannot cure this, and that's why it's important to prevent it and don't get it in the first place. I think when we're dealing with something like heart disease, which is obviously very important, right? I think we must be quite clear, right, that we must use treatment which is proven to be of benefit. And alternative medicines, unfortunately, you can claim whatever you like. It's easy to claim and put forward, so-called alternative treatments which are claimed to work well. But I think we need proof that it does work. One of the risk factors for heart disease is stress. So I suspect if you meditate and reduce your stress levels, yes, it might help to complement it. But if that is the main form of treating, if you have already got heart disease, no, I don't think so. You cause your husband to have the heart attack.
Yeah, it'd be very stressful.
I don't have a husband.
Good.
I'm also a really good husband.
You
One
are.
of the best.
And
So you do
all
the
the time.
laundry.
So, yeah.
So you do the
No
laundry.
worries.
Oh wow.
So laundry is a form of exercise. I think you need to exercise 30 minutes a day, right? To do minimum. So I think laundry is part of the exercise that you need to do. But I guess, well, smoking is bad. Smoking is going to cause heart disease.
This is a sexist question, man. Why our husband can't do laundry? This is just like during the MCO. Remember not that the one man has to go and do the shopping.
Yes.
And then they had this thing. Oh, this is all the different fish.
Yes,
As
yes.
if we never went shopping before and we don't
Correct.
do it all the time. Anyway, it's nothing to do with
Yeah, it's a bad
cardiology.
question.
Yeah,
But
it's a
honestly,
good
before
question.
MCO, when was the last time you went shopping for food?
No, I do it all the time.
I
Oh,
do
you?
it as well, yeah. I love shopping. Bad man. So, so smoking definitely, right?
Okay, smoking, don't need to say here. This one says heavy smoking. I want to make the point, any smoking.
Any form, right?
Any form of
Even
smoking,
vaping.
even vaping.
Yes.
Whether you smoke 1 cigarette a day, 20 cigarettes a day, 60 cigarettes a day, it's all
Bad. Bad for your
No
heart.
smoking at all. I think that has to be stressed.
I think so. No smoking, right?
No
It's
smoking.
bad for the heart.
Bad for the heart.
So heart
very
goes-
bad for the heart. Not bad.
No
very
smoking.
bad.
Harry was only smiling when you talk about smoking.
Yeah. You can have high cholesterol and be thin. So it doesn't always follow that only fat people have high cholesterol and have the risk. I think being obese is just a reflection of poor lifestyle, right? It's a consequence, the result of a poor lifestyle. And when you have a poor lifestyle, everything else comes in, as far as heart disease is concerned. Because you don't exercise enough, your blood sugar goes up, you take too much salt in your food, you're taking too much sugar in your food, you get diabetes, and diabetes is like the mother of all illnesses,
You said skinny people can have high cholesterol. So if I've got high cholesterol and I diet, why wouldn't my cholesterol go down? Why do I have to take medication?
In general, people have this idea that fat people have high cholesterol because they eat too much.
Yeah.
Okay, so why do skinny people have high cholesterol? Because if you look at cholesterol levels in the blood, the contribution from food is actually probably about 30%.
Correct.
70% is from your liver production, right? So if you reduce your food intake by half, for example, you only drop your cholesterol level 15% at the most, which is not much.
So you're saying most of the cholesterol, bad cholesterol, is actually made by your own liver.
Yes.
By our own liver.
It is. Broken heart. Have you ever experienced a broken heart?
Yeah, a few times.
Even now.
No lah, now settle.
Settle.
But you better explain to people what heart failure is, because a lot of laymen don't know what heart failure is. When you say heart failure, they think you died or you had cardiac arrest. The public don't have an idea about what heart failure is.
There is a Malay term for it called lemah jantung.
Okay.
All right, which means the heart is weak. Literally means a weak heart. Okay, so in most cases, what happens is that a patient gets a heart attack. And when you get a heart attack, part of your muscle, the heart tissue is actually dead, dies. And because of that, it can no longer function. And remember, the heart is a pump, right? It does that and it relaxes. So the most common form of heart failure is inability to pump enough to meet the demands of the body. Okay, because part of the heart is damaged. So you have a weak heart. Essentially, the heart is weakened, and therefore it's not able to pump enough blood round for the body to function normally. And then because of that, you get other symptoms because of backflow of blood into the lung, etc. You get breathless. So that's the most common symptom of heart
Paru-paru
failure.
masuk air.
Yeah.
So dia lebih ke paru berair when the Malays. But essentially that term lemah jantung is correct because the heart is actually weak and cannot pump.
I think if you have that bad genes, then it's very high. You had a very high chance of getting diabetes as well. Very high chance of getting high cholesterol, hypertension as well. So I think so there are things that you can modify, and there are things that you can't modify. And unfortunately, we can't modify our, like you say, our genes, our age. So I think there are things that you can modify, and that's where we really need to look after ourselves.
It's interesting because even those things that you say you can modify, like diabetes, high blood pressure, and high cholesterol, are also partially genetic, right?
Yes.
Yeah, so if your parents have got those things, your risk to get them is also slightly increased,
Yes.
right? So, yeah, family history is important. Yeah.
Very important.
Family is important.